Hello everyone and welcome back to our channel. I'm Dr. Mayank, your host, and today we have an interesting topic to discuss, Gilbert syndrome. Now you might be wondering, what exactly is Gilbert syndrome? Well, don't worry because we're going to dive deep into this condition and uncover all the essential details you need to know. So let's get started. Gilbert syndrome is a relatively common and benign genetic condition that affects the liver. It is named after the French gastroenterologist, Dr. Augustin Nicolas Gilbert, who first described it in 1901. This syndrome is characterized by higher than normal levels of a substance called bilirubin in the blood. Bilirubin is a yellow pigment that is produced when red blood cells are broken down. It is processed by the liver and eventually eliminated from the body through stool. However, in individuals with Gilbert syndrome, the liver is less efficient at processing bilirubin, leading to its accumulation in the blood. To comprehend the pathophysiology of Gilbert syndrome, we need to grasp the basics of bilirubin metabolism. Bilirubin is a byproduct of heme breakdown, which originates from the breakdown of red blood cells. This unconjugated bilirubin needs to be processed in the liver to become conjugated bilirubin for excretion. Gilbert syndrome has a strong genetic component. It is caused by a mutation in the UGT1A1 gene, which is responsible for producing the UGT1A1 enzyme. This mutation leads to reduced enzyme activity, impairing the liver's ability to conjugate bilirubin effectively. In individuals with Gilbert syndrome, the reduced UGT1A1 enzyme activity results in decreased bilirubin conjugation, leading to the accumulation of unconjugated bilirubin in the bloodstream. This excess bilirubin can cause the characteristic yellowish discoloration of the skin and eyes seen in patients with Gilbert syndrome. While Gilbert syndrome is generally asymptomatic, certain triggers can exacerbate the condition. These triggers include fasting, dehydration, physical exertion, stress, and illness. During these episodes, bilirubin levels may rise, causing temporary jaundice and fatigue. The mechanisms behind the triggers are not yet fully understood. It is believed that these factors, such as fasting or stress, cause alterations in the levels of certain hormones and enzymes, further reducing the already impaired UGT1A1 enzyme activity. Consequently, this leads to increased unconjugated bilirubin levels and the manifestation of symptoms. So, what are the symptoms of Gilbert syndrome? Well, the interesting thing is that many people with this condition may not experience any symptoms at all. In fact, it is estimated that up to 5% of the general population may have Gilbert syndrome without even knowing it. However, in some cases, individuals may experience mild and intermittent symptoms such as jaundice. This is the most common symptom of Gilbert syndrome. Jaundice causes a yellowish discoloration of the skin and eyes due to the elevated levels of bilirubin. Fatigue. Some individuals may experience fatigue or a general feeling of tiredness, although the exact reason for this is not fully understood. Abdominal discomfort. A few people with Gilbert syndrome may have mild abdominal pain or discomfort, which can be intermittent. Now, it's important to note that Gilbert syndrome is a benign condition and does not lead to any long-term complications or liver damage. It is usually diagnosed through a blood test that measures the levels of bilirubin in the blood. If the levels are consistently elevated without any other underlying liver disease, the diagnosis of Gilbert syndrome is made. So, how is Gilbert syndrome managed? Well, the good news is that most individuals with this condition do not require any specific treatment. The elevated bilirubin levels in Gilbert syndrome are usually harmless and do not require medical intervention. However, it's essential to be aware of certain factors that can temporarily worsen the symptoms. These include fasting, dehydration, illness, stress, and certain medications. By avoiding these triggers and maintaining a healthy lifestyle, individuals with Gilbert syndrome can effectively manage their condition. In rare cases where the symptoms are severe or causing significant discomfort, a healthcare professional may prescribe medications that help lower bilirubin levels. But again, it's important to emphasize that most individuals with Gilbert syndrome lead normal, healthy lives without the need for medication. Before we conclude, let's address a common question. Is Gilbert syndrome hereditary? The answer is yes. It is an inherited condition caused by a mutation in a specific gene called UGT1A1. If one or both parents have Gilbert syndrome, there is a higher chance of their children inheriting it. However, it's important to remember that having the gene mutation does not necessarily mean an individual will develop Gilbert syndrome. Many carriers of the gene mutation remain asymptomatic throughout their lives. Hello everyone and welcome back to our channel. I'm Dr. Mayank.